Welcome to our Doctor Channel, your destination for reliable medical information, breakthrough research, and insightful discussions on all things health-related.
Testicular cancer is a relatively rare form of cancer that develops in the testicles, which are the male reproductive organs responsible for producing sperm and hormones. Here's a detailed description of the symptoms and causes of testicular cancer. Symptoms of testicular cancer. Testicular lump or swelling. 1. The most common symptom is the presence of a painless lump or swelling in one of the testicles. 1. It might be small or large and is usually detected by self-examination. Testicular pain or discomfort. 1. Some men may experience pain or discomfort in the affected testicle. 1. The pain might be dull or sharp and may radiate to the lower abdomen or groin. Heaviness or aching in the lower abdomen or scrotum. 1. A feeling of heaviness or aching in the lower abdomen or scrotum can be a symptom of testicular cancer. Change in testicle size or shape. 1. Testicular cancer can cause changes in the size or shape of the testicle. 1. One testicle may become noticeably larger or appear different from the other. Fluid buildup in the scrotum, hydrocele. 1. In some cases, testicular cancer may lead to the accumulation of fluid in the scrotum, causing swelling. Back pain or lower abdominal pain. 1. Advanced cases of testicular cancer may cause back pain or lower abdominal pain. 1. This occurs when the cancer has spread to other parts of the body. Breast tenderness or growth. 1. Rarely, certain types of testicular cancer can produce hormones that cause breast tenderness or growth, gynecomastia. It's important to note that these symptoms can also be caused by non-cancerous conditions, such as infections or injury. However, any persistent changes or abnormalities in the testicles should prompt a medical evaluation. Causes and risk factors of testicular cancer. Age. 1. Testicular cancer most commonly occurs in young and middle-aged men, with the highest incidence in men aged 15 to 35. 1. However, it can occur at any age. Cryptorchidism, undescended testicle. 1. Men who had an undescended testicle at birth, cryptorchidism, are at an increased risk of developing testicular cancer. 1. Even if the undescended testicle was surgically corrected, the risk remains elevated. Family history. 1. Individuals with a family history of testicular cancer have a higher risk. 1. Having a brother or father with testicular cancer increases the risk, especially if the affected family member had cancer in both testicles. Personal history of testicular cancer. 1. Men who have had testicular cancer in one testicle have a slightly increased risk of developing cancer in the other testicle. Race and ethnicity. 1. Testicular cancer is more common in white men than in men of other races and ethnicities. HIV infection. 1. Men with human immunodeficiency virus, HIV, have a higher risk of developing testicular cancer. Testicular microlithiasis. 1. Testicular microlithiasis, a condition characterized by tiny calcium deposits in the testicles, has been associated with an increased risk of testicular cancer. While these factors may increase the risk, the majority of men with testicular cancer do not have identifiable risk factors. Early detection through self-examination and regular medical checkups is crucial for effective treatment and a positive prognosis. Men are encouraged to perform regular testicular self-exams and seek medical attention if they notice any changes or abnormalities. Treatment of testicular cancer. The treatment of testicular cancer depends on several factors, including the type and stage of the cancer, the presence of specific markers, and the overall health of the patient. The primary treatment modalities for testicular cancer include surgery, chemotherapy, and, in some cases, radiation therapy. Surgery, orchiectomy. 1. Description: The mainstay of treatment for testicular cancer is the surgical removal of the affected testicle, a procedure known as orchiectomy. 1. The surgeon removes the entire testicle through an incision in the groin. 2. Purpose: orchiectomy serves multiple purposes, including confirming the diagnosis through pathology examination and eliminating the primary source of cancer. Retroperitoneal lymph node dissection, RPLND. 1. Description: in some cases, especially for certain types of testicular cancer, surgery may involve the removal of retroperitoneal lymph nodes, a procedure known as retroperitoneal lymph node dissection, RPLND. 2. Purpose: RPLND is performed to address potential spread of cancer to the lymph nodes and is usually considered after orchiectomy. Chemotherapy. 1. Description: chemotherapy involves the use of drugs to kill cancer cells or stop their growth. 1. It is often administered after surgery to eliminate any remaining cancer cells and reduce the risk of recurrence. 2. Regimens. Common chemotherapy regimens for testicular cancer include BIP, bleomycin, etoposide, and cisplatin, and VIP, etoposide, ifosfamide, and cisplatin. Radiation therapy. 1. Description: radiation therapy uses high-energy beams to target and destroy cancer cells. 1. It is not a routine treatment for testicular cancer but may be considered in specific situations, such as if cancer has spread to nearby lymph nodes. 2. Target: radiation is typically targeted at the retroperitoneal lymph nodes. Follow-up care. 1. Description: after the completion of primary treatment, regular follow-up care is essential. 1. This includes physical examinations, imaging studies, and blood tests to monitor for any signs of recurrence. 2. Frequency: follow-up visits are typically more frequent in the first few years and then may be spaced out based on the patient's response to treatment. Clinical trials. 1. Description: participation in clinical trials may be considered, especially for cases that are high risk or where novel treatments are being investigated. 2. Innovative therapies. Clinical trials offer the opportunity to access innovative therapies and contribute to advancing the understanding and treatment of testicular cancer.